Okay, hi everybody, I'm Jeanette, this is Nigel, and as it says, we're from the British Red Cross. We don't get that funny, we are just from the Red Cross, but the British Red Cross is a national society. And one of the big things that obviously that we want to get across is building resilience. One of the big things that we keep talking about today is promoting resilience and trying to give people skills to boost their confidence in being able to act in an emergency. We come from the local area, Suffolk, Norfolk and Cambridgeshire we work in, and our service is community-based first aid. We call it adult education now, but it's all about getting out into the community and teaching some first aid. The difference for our service is that we're very much wanting to get to the people that could benefit the most from learning some first aid. So potentially are living with or have maybe an issue with drugs or alcohol and are in that kind of community that could benefit from actually learning some first aid and ultimately save lives. So you can still book on, a member of the public can still book onto first aid courses with the Red Cross, but ours is very much about getting out into the community, getting out to groups of people, and we will tailor our sessions to meet the learners' needs. Okay, so it's very much making sure that the topics are very relevant for them. So today we've been asked to talk to you about what to do in the event of an overdose. So it's very much going to be around about the unconscious casualty. And one of the big things that we've learnt today is that it's going to have obviously quite drastic effects on the body. So that could lead to someone becoming unconscious. Okay, and when someone becomes unconscious, it's basically that it could be that they're starved of oxygen, and we've already heard the effects of these, what drugs can do to the body, and that's going to put a big strain, obviously, onto the heart, trying to pump that oxygenated blood around the body, and ultimately the brain as well. So the body will become unconscious because it can't cope. All right. So. One of the things we want to do, though, very first and foremost, is trying to break down some of those barriers as to why people may not act. So if someone did come across an unconscious casualty, why potentially would they not do anything? So we want to try and break down some of those myths that go alongside perhaps why someone wouldn't call 999 or do something to help. So we're just going to show you a short video here of trying to answer some of those questions that very often come up.
We're making this video because we know many drug users won't phone an ambulance when one of their mates overdose because we believe the police are going to come flying through the door with the ambulance staff.
You know how it feels when someone ODs. The panic, the fear that you might be held responsible, might be arrested or busted for any drugs you might have. The fear that they might die and a strong desire just to walk away. It is so important to make that call and save a life.
That's all very well. What if I've got an outstanding warrant? What if I'm out of prison and licensed? What if the police are after me?
We won't know about any of that, and we're not interested in all of that. Even if you're not happy to give us your name, we really need you to make that call. We just want to be able to get to the person who's overdosed quickly so we can treat them straight away. We won't call the police just for drug use. An overdose is a health matter, it's not a police matter.
What if I'm carrying drugs? What if I'm dealing from my house? What if I prepared gear or injected my mate who overdosed?
We won't call the police for any of those reasons. All we're interested in is the safety of the person who has collapsed so that we can treat them as soon as possible and save that person's life. Acting quickly at this stage is vitally important if we want to keep that person alive.
So what actually happens when someone does call 999 for an overdose?
Ambulance emergency, do you have a postcode or address we can come to? The address is vital, so we can immediately find the nearest ambulance to send to that address. Okay, and tell me exactly what the problem is, what's actually happened. This is important so we can plan how many vehicles to send. Is he awake?
Yeah.
Is he breathing?
Yeah.
This is important because your actions at this point can save the person's life. I will tell you what to do to keep someone's airway clear and keep them breathing. Okay, now can your friend be violent? This is important as we must protect staff and we cannot treat a patient efficiently in a violent situation as this could cause delay. Now we've organised help for him now. Stay on the line, I'll tell you exactly what to do next. When there is a life-threatening situation like an overdose, we like you to stay on the line until a paramedic arrives so you can give first aid if needed. This can be life-saving and I can tell you exactly what to do.
So, when would you call the police?
Well, firstly, when we might be at risk of violence. For instance, when we know people have been violent or threatening towards ambulance staff before at a particular address, or when we're threatened when we're on duty. We have a right to be protected and a right to get to the patient as quickly as possible. Secondly, there may be occasions when we have to call social services. If we see children who are at risk or they have no one to look after them, we have a duty to protect children, as you would expect. And thirdly, if the caller tells us that someone has died, or when we arrive we find someone has died, we are obliged by law to tell the police.
So, there are some occasions you would call the police?
Yes, but only as I've described. Even if you're worried that the police might be called, we really want you to make that call. You don't have to give us your name. If you're so worried that you feel you cannot stay, you can call 999 and then leave the premises. But we don't want anything to get in your way. We really need you to make that call as soon as possible.
So make that call, whatever the circumstances. Seconds save lives, make that call.
We will only call the police if we are at risk, children are at risk, or someone has died. Make that call.
Right, let's finish now. Okay, so hopefully that will help to sort of alleviate some of the worries around when someone would, obviously when the police may be called. And the most important thing is to be able to call 999 and get the ambulance service there as quickly as possible. But of course it's recognising that when it is an emergency, and what can we do? How can we build our own confidence? Our own personal safety is obviously paramount. So there are steps that we can take, and if your safety obviously is compromised, then there is always something you can do, and as I say, that's called 999. Get the professionals in there to be able to help out. Okay. So what I'm going to do now is actually demonstrate what to do if you come across someone who is unconscious. Okay then, so if someone has become unconscious, we have to say that the style that we now deliver in at our level, at local level, we call it everyday first aid. Because what we're trying to do is give you skills that you can apply into the context that you may find yourself in. Okay? These things don't tend to happen in a nice classroom environment. So people are more likely to collapse up against in a sort of a confined space that obviously could make it quite difficult to have confidence to know what to do. So, but Nigel seems to have collapsed in quite a nice area for me to be able to get around, so that's quite handy. Remember we were saying about looking out for your own personal safety. So what you can do really is from afar is already start to observe the situation. Have a look around there. Is it dangerous for you to approach? Is there a broken glass? Is there needles? Are there things around there that you need to be careful yourself? Okay? So you don't want to become the casualty yourself. What you can do then is what you want to do is try and get response out of them. Yeah? So maybe it could be that they've had a few drinks and they're actually really just having a good old sleep. But they're not going to be very happy when you try and wake them up. So look out for your own personal safety. Shout at them, come on Nigel, come on, wake up, what are you doing? You're supposed to be helping me here. No, nothing at all. Now, you may have been taught in the past to go straight down there and give them a good old rub on the shoulders. But in this situation, like you say, looking out for your own safety as well, maybe it'd be easier just to tap the bottom of the foot. The bottom of the foot is very sensitive. So you can tap the bottom of the foot and you're not putting yourself in a vulnerable position. Okay, so then if he is having a bit of a kip after having a bit of a skinful at dinner time and he's really not happy about it, I'm in a good position to get out of the way. Okay, so come on Nigel, come on, wake up. Look, time's ticking away here. Nope, nothing at all. So now I'm not getting a response, so I am going to go down, give them a bit of a push on the old shoulders. Come on, try and give them a command. When someone's unconscious, they may still be able to hear you, but they're just not able to respond to you vocally. So come on, open your eyes. Nope, nothing at all. So what we need to be doing now is making sure to see if they're breathing. Now, can you see whether they're breathing from where you are? Yes. What can you see? Exactly. So again, that's something that you actually could do from afar. If you look long enough, we actually breathe quite slowly. So look from afar, you can see the stomach's going up and down. It's going up at a nice even rate, yeah, like you and I, which basically means they're getting oxygenated air in. That's good. But remember, when someone's unconscious, their body's going to slump. All their muscles will become very relaxed. So the chances are their airway could be compromised. It could be in a bit of a slumped position, okay? So we do something called opening the airway, and that will give them the best possible chance of being able to get the oxygenated air in if they're able to breathe properly, okay? So the way we do that is you need to get down, 2 fingers under the chin, 1 hand on the forehead, and tip their head back. Okay, you're basically now opening up their airway, which is giving them that nice passage down into the lungs, getting that oxygenated air in. Okay, so open up the airway. The mouth would slump open, so you can have a look inside to see if there's any vomit or horrible stuff in there. We don't go poking around in people's mouths in case we push anything further down. But if there's anything that you can see that you can remove quite easily, then please do. Okay. So I've had a quick look in there. No, we're all okay, fortunately. So we've opened up the airway. I can see that he's breathing okay, but there are other ways to check to see if he's breathing. Anyone remember what they are from any first aid training you've done? Not the pulse. We don't actually go for the pulse at this point because it's actually quite hard to find. There's a really easy thing you can do. One, you've seen that the stomach's going up and down. Check to see if there's any breath coming out the nose and the mouth. Yeah? Put the back of your hand down, yeah? So you're not putting yourself in a vulnerable position. Back of the hand, I can feel it on the back of my hand coming from his nose and his mouth, okay? Textbook would tell you to put your cheek down, yeah? Put your cheek down, look down the body, and if I'm doing it that way, then I can feel it on my cheek, I can hear him breathing, and I can see the stomach going up and down at the same time. Multitasking, fantastic. So he is breathing, that's good news, all right? But we do need to make sure that the ambulance is on its way. We know why they're unconscious, yeah, because they've taken something or too much alcohol. So we need to give them the information of why they're unconscious, they are breathing, and importantly, where we are. All right? Get them there as quickly as possible. Do I leave him on his back? This is the key skill that I want you to take away from today, okay? Nodding heads, shaking heads? No, we don't leave them on their back. Why don't we leave them on their back? Choking. Exactly. This is the big thing. Vomit, when you're unconscious, your muscles, your body is not going to react in the same way. So he's not going to have that gag reflex that we would normally have to be able to get rid of any vomit. So any vomit that comes up will pull with saliva and they will potentially choke to death. Yeah, that's the big killer. All right, but also the muscle in your mouth, the tongue, could fall back and block your airway. So there's one position we can put them in that will keep them safe until the ambulance gets there. You can call it the recovery position, you can call it putting them on their side, you can call it a safe position. We don't mind what you call it, as long as you remember you need to get them on their side. And it doesn't have to look pretty how you do it. Okay? You can push them, you can pull them. It might all depend on where you found them, of what you can actually do. All right? So I'll show you both ways. The best way, if you've sort of been taught sort of textbook way, is to get the hand closest to you out the way, the knee and the arm opposite to you. You want the hand, which I'm just going to put on the back of his cheek. I'm going to bring his knee up. Okay, so this knee now is my lever, and it doesn't matter the size of the person, you're going to be able to get them over. Okay, pull them over towards me. Okay, and make sure the head's tilted back, because when you roll someone over, again, they could become slumped and compromise that airway. So open up the airway, check to see if they're still breathing. Keep talking to them. The last sense to go is their hearing, so keep talking to them. Ambulance is on its way. I'm here to help you. And if you want, that's when you could check the pulse then, because you've got that bit of time. Now remember, depending on the situation, stay with them. But if you don't feel comfortable doing that, then obviously make sure you call the ambulance and you've got them on their side. Great thing to do. I'll just push him back again. Never worry about what you're doing with the arm, because actually all you're doing is being nice. So you're not rolling them on it. That's all you're actually doing. I'm just going to shove that out the way. There we go. Yeah? Just get them on their side. So it doesn't have to look pretty how you do it, as long as you know that you're putting them on their side, because you're going to save their life by doing that. All right? Yeah? Thank you. Actually, do you want to lie in your front? Sorry, while you're down there. It's quite nice we've got carpet for this one. Can you do the same thing for someone lying on the front? Do you have to roll them on their back to be able to do exactly the same thing? No, that's right. Basically, just remember what we've done before. Come on, looking out for those dangers. Come on, Nigel. Come on, wake up. No, can you see whether he's breathing? Yeah, you can still see that he's breathing. Come on, open up the airway. His face is in a puddle of mud or something. You can be nice and obviously move it out the way. Open up the airway. Now all I'm going to do, I could leave him like that, to be fair. But what I'm going to do, actually, I'm going to be really quite nice to him. I'm just going to put his hand under his cheek. That's just being nice. And just to take the pressure off around the stomach and the respiratory area, I'm going to push in there and pull up there. Okay? And now he's in that safe position, comfortable position. So remember what it looks like and get them in that position. It doesn't have to look pretty how you do it. All right? Are there any questions on that? Do you think you can remember that? Yeah. Yeah? Do you think it's important that we get out there and teach more people that? Yeah, so that any groups at all that you'd like us to come to, please do get in touch. Okay? Thank you, Nigel.
I'm now going to be looking at the resuscitation side of life. So we're looking at a casualty who is unconscious and not breathing. Now for this, we're doing chest compressions and breaths. And Jeanette, with the police knows, I am not going to be using her. Okay? However, I've got my mate Steve. All right? So that's what I'm going to do. As explained before with Ruth, I'm going to show two methods here. Firstly, the one we're looking at, an opiate-based overdose with the naloxone that Ruth was talking about before. So therefore, as explained, the body finds it quite hard to absorb oxygen. So therefore, we've got to look at the chest compressions and the breaths. But then on the flip side as well, as explained by Jeanette, we cover everyday skills. So remove the clinical, remove the technical. We want you to do something rather than nothing. So we'll be looking at the chest compressions only. And I don't know how many people have seen the Vinnie Jones advert on TV that came out probably about a year ago. We're going to be looking at that, which is the hands-only CPR. And as he says, you don't kiss them on the lips. You don't even kiss your nan on the lips. All right? So that's what we're going to be looking at. So the first one we're going to be looking at is the chest compressions and the mouth-to-mouth. All your checks are carried out beforehand, as we've just seen demonstrated here. Obviously, top priority, make sure you're safe. We've got to try and wake the person up. We then try and establish to see if they are breathing or not. If they are not breathing, the very first thing we need to do is what? Thank you very much, sir. Yes, call the emergency services. That is a priority. And hopefully you got that from the myth-busting video there as well, where they are saying that is what you have got to do. Call the emergency services straight away. Nowadays, the majority of people have got mobile phones. They can put the speaker on, they can sit it right next to them, and they can talk through it. All right? Because again, you may be on your own when you have to do this. And I'll tell you from experience, it's not a very nice thing to do on your own. All right? Hopefully, that operator on the end of the phone is there to help you. They're not the Grim Reaper, all right? They are sat in a nice little place, swivel chair, cup of tea, touch screen in front of them with all the information to help you guys, all right? So it's always good, call the emergency services. We can still act. We can still do something with the beauty of hands-free. Ideally, if you can, we're shouting for help as well. So try and get somebody to help you out. First things first, like I said, the body finds it hard to absorb oxygen on an opiate-based overdose. All right, so we have got to do something about it. Hence, we're looking at putting the breaths in. First thing we need to do, the second thing we need to do, because the first thing was call the emergency services, is give 5 initial rescue breaths. Okay? We want to oxygenate the body again. So 5 initial rescue breaths. We then go into the process, and I don't know if anybody's done first aid before, we go into then the sequence of 30 compressions to 2 breaths, and just continue that motion. So it's only 5 initial rescue breaths we do. All right? I'm going to demonstrate it in a minute, so if you want to come closer and see what I do, but what I will do, I'll just quickly talk through it. When we're doing the 5 initial breaths, the head is already tilted back. Make sure it is. We're pinching the nose with our thumb and forefinger. Ideally, you can put your hand on their forehead and pinch at the same time. Also, as well, no need to yank their mouth open. Your mouth needs to be the bigger of the two. Okay? And all we're doing is making that seal. A good seal, 5 good breaths. Top tip, always turn away between each breath. One of the main reasons is they may throw up after the first one. If your mouth's still over there, guess where it's going to go? Okay, so that's one of my advice.
It's nice after lunch, isn't it?
Yeah, I don't want to play one off. Secondly, we can also then see the chest deflate. And if they are going to throw up, it will go in your ear rather than your mouth. All right, so that's not too bad. So that's what we're doing in between each breath. Once we've carried out the 5 initial rescue breaths, we then go on to chest compressions. Chest compressions, we use the heel of our hand, okay? It goes into the centre of the chest. Right in the centre of your sternum, you got a nice little groove, a nice little dimple made for it. Try not to use your hand, try not to use your fingers, because that's when you may cause problems, i.e. breaking ribs, etc. So it's got to be a good connection with the heel of the hand. Your other hand can either go on top and interlock, or on top and just lock your thumb around the back of the wrist. Whichever is simpler for you. All right? And you notice then I'm using 2 hands because the majority of times we are dealing with an adult. All right? So it's a 2-handed compression. Don't worry too much about depths. All right? It is 5 to 6 centimetres depth of compression. What I will say is, don't go in there lightly. You've got to try and keep this person alive. And doing that is a good compression on the chest. You're not standing there with a ruler to measure the depth of compression. It's a bit of a guesstimation. If you're jumping up and down on them, you will hear ribs break. Just ease up slowly, but continue the motion. All right? This is life-saving. And it's doing something rather than nothing. Like I say, once we've done those 30 compressions, there's a bit of a rhythm. Can anyone think back to the Vinnie Jones advert? What was he singing on that one there?
Staying alive.
Staying alive. Pretty apt, isn't it? For those who know the Bee Gees. Yeah, there's probably a few, isn't there? Some people taught Nelly the Elephant. Anyone remember that one? Yeah? No? Me, I'm a bit of a Queen fan. I can remember that one. But I always sing Another One Bites the Dust, but don't sing out loud. Right? But it's the beat. That's what I'm going for. 100 to 120 beats a minute. Don't sing that one out loud, though, all right? So, hopefully try and remember one of those 3. Right, what I'm going to do now is I'm going to demonstrate. And what I will demonstrate is 5 initial rescue breaths, 30 compressions, 2 breaths, 30 compressions, 2 breaths. If I fall over, come and help me, all right? Like I said before, it's ideal if you've got somebody to help you because it does take a lot out of your body as well. So, going through the normal checks that Jeanette did with me, making sure it's all safe, trying to get a response, tilting the head back, 10-second check, are they breathing? Okay, quick check. I've established they're not breathing. Next thing, call the emergency services. Like I said, the phone can go down there. I need to oxygenate their body straight away. So it is 5 initial rescue breaths. Like I said, hand on the forehead, pinch the nose, tilt the head back. Sometimes people don't know what to do with this hand. Please don't go like that. Okay, I've seen it. Tuck your hand up the back, out the back of the neck, all right? It does help. There's your 5 initial rescue breaths. Straight into the chest compressions. Heel of the hand. Straight into the centre. We always used to like to say, yeah, look at the nipple line or underneath, kind of like the arm. According to the age of the nipple line, sometimes it's further down here. So just do a guesstimation. All right, that's what we're looking at. Heel of the hand, centre of the chest. Hand over the top and start compressing, singing a song. Two breaths. Who's singing the Bee Gees then? Yeah. 30 compressions.
We don't actually make that noise, funnily enough. That's just letting us know we're going down far enough on the mannequin. And never worry that you've lost count. If you don't do 30, you do 24, or you do 32, or 33, it doesn't matter.
And so on. Okay? Any questions on resuscitation using breath and chest compressions? No? Okay. Let's now look at the everyday skills that we use, the simplified. Remove the clinical, remove the technical. Keep it simple. First thing I need to do, once I've established that this person is not breathing, is still call the emergency services, okay? Their day is not going to get any worse, is it? Really? Unless you walk on by. So, get the emergency services involved. Sometimes some of that information that I've told you before about, oh, now what have I got to do? Rescue breaths, 2 breaths, how far, how many? We'll keep it simple. All we want to do is chest compress. Because if you and I were to keel over, we've got probably about between 8 and 12 minutes of oxygenated blood in our body. That's what we want to pump around the body to keep mainly things like this alive. All right? So doing something rather than nothing, and chest compressions will do exactly that. And literally, as I've explained before, heel of the hand again, straight into the centre of the chest, get down there and start singing the Bee Gees. And just compress. And compress. And keep on compressing. When can I stop compressing? Perfect, there's one. Emergency services turn up. Give me another one.
Another person that can take over.
Perfect. You got a book there or something? 2 more.
When they wake up.
When they wake up. Yeah, nice one. Don't always think that that's going to happen. They're going to sit up and shake your hand and say, thank you, all right? Doesn't always happen. Last one, though. When can I stop?
When they start breathing.
That's kind of like the same as that, isn't it? When they wake up. The last one is if I physically cannot do it any longer myself, all right? I might not get help. Somebody might not come and help me. But what I don't want to do is become a casualty myself, okay? So I have to do it. Luckily for us, we've got that good drug inside us called adrenaline. And we will put our pants on the outside of our trousers and we will get on and do it.
You haven't got time to put your pants on the outside of your trousers.
They're already there.
We've talked about this, Nigel.
Okay, and that is it. That is what we're doing for the everyday skills sessions on chest compressions and the CPR side.